Our first speaker today is Richard Sprott, who will be speaking about the International Kink Health Study. Richard, take it away.
Good morning, everybody, or afternoon, wherever you are. I've got a short PowerPoint to help me keep my thoughts together as I talk about the International Kink Health Study. So let's begin. And I'll talk a little bit about myself as we're going along. You can find out more information about this study later on at kinkhealth.org. First, this is a research project by TASHA, the Alternative Sexualities Health Research Alliance, which is a community-based research organization, a 501c3 nonprofit, founded back in 2012. The mission is to improve the physical and mental health of people who engage in non-traditional sexual practices, including BDSM, kink, and sexual fetishism. That's our focus. We propose TASHA does a number of things to meet this mission. That is to conduct research, which is what we're here today to talk about, to document kinksters' use of the healthcare system and their experience of the healthcare system. We then take a lot of that information and turn it into trainings for mental health care providers and medical providers to increase the delivery of culturally competent, knowledgeable care. And then we also try to do community education around healthcare and how people can be effective partners in their own healthcare. And then we also address policies and advocate for the equitable treatment of people who are kink involved. So all of that is part of what TASHA does. The International Kink Health Study is our current big project. So we were founded in 2012 and immediately started in designing our first study, which was in 2013, the Kink Health Project, which was a qualitative interview study of San Francisco Bay Area kinksters. We're situated in the San Francisco Bay Area. We did one-on-one interviews. We did focus group interviews with about 120, 125 Bay Area kinksters about their health, about how health and kink interact, about their experiences in the healthcare system. We heard a lot of sort of the initial, I would say, the initial themes that have actually carried out through all the other studies, which is to a certain degree, a fair amount of reluctance to disclose kink involvement with their medical providers and with their therapists and counselors, and hearing about some injuries and how people coped with that. All of the results of that, we published a couple of papers about that. And then in 2016, we launched the follow-up, which was the Kink Health Survey. And that was mixed methods, a survey, qualitative and quantitative data of US-based kink identified people. We're still just about coming to the end of the data analysis of the 2016 Kink Health Survey. We had about 1,800 people access the survey. We ended up with about 1,100 usable surveys. We have published a number of papers based upon that, and we are planning, I think, about another 3 or 4 to report on the results. And some of those are actually pretty close to being submitted to peer review for certain journals. The results indicated a number of possible health disparities, some other major health issues facing the community. And so we started to design, roughly about 2018, we started to design the current study, the International Kink Health Study, which is going to be a longitudinal mixed method study of kink-involved people, and it's going to be international. One of the reasons is because we had so many people outside the United States try to take the 2016 survey. Clearly, there was a lot of interest, and so we decided not to limit it to the US this time around. So each study has built on and set the foundation for the the following study. And we see the International Kink Health Study, because it's longitudinal, is going to be a very powerful way of really looking at the intersections of kink and health. The objectives of the project include to document the prevalence of injuries and medical complications arising from kink activities. The 2016 data suggested about 1 in 8, about 13%, people reported having some sort of medical complication or an injury from kink activity, with bondage being the most frequent kink activity that had some sort of injury or medical complication. There were several others, of course, but so we're going to look at that more closely in the current study. We're going to document how healthcare is utilized. We're going to get a lot more information, better information exactly about that. The 2016 Kink Health Survey was very surfacey. It only asked a few questions about injuries. This time we're going to ask a lot of questions about injuries when people report them. We're going to document the health outcomes, in particular, some of the health disparities that jumped out that we want to look at more closely are things like suicidality. We saw a very high reported level of suicidal ideation and suicidal behavior at some point in people's lives. We're going to look at that more closely and try to figure out the timing of getting involved in kink and suicidal ideation. The same thing for non-suicidal self-injury. We also are going to be looking at aspects such as drug and alcohol use and obesity and a few other things. The other thing is that the International Kink Health Study is going to look specifically at 2 variables. There's a couple of others, but these 2 in particular, growing out of the 2016 data. And that was the centrality of kink identity as a moderator, and also the degree of community belongingness and how it affects certain outcomes. So our goal for this is to get a minimum enrollment of 3,164 people. And we're going to just keep collecting data year after year until attrition lowers our sample size to less than 900. Here's our current model that we're going to be looking at and testing. You see the centrality of kink identity, community belongingness, but we'll also be looking at sensation seeking, adverse childhood events, and different types of kink behavior and kink role. And you can see the particular measures there. In terms of time, I won't be able to get into the details here, but you can always contact me later. All right. So for more information about this, you can contact me, Richard at TASHA, Anna Randall, who's the Executive Director of TASHA and also the co-PI on this project. You can go to the website, kinkhealth.org, and our social media presence at Kink Health, Twitter and Instagram. We also have a Facebook page, and a FetLife profile page to communicate back to the community through that channel. So that's the overview of the project. Got some time for some questions. If anybody has any.
You're welcome to turn on your microphone or type into the chat any questions that you might have for Richard at this time. And if Richard provides me any follow-up information, I will email that to all participants today so they can reach out to Richard and learn more.
Let's see.
There's a question in the chat.
Okay.
Well, two questions. First, do we get the PowerPoint?
Sure. I'd be happy to.
Right. And the next question.
I'll send a PDF of it.
Okay.
When does it start? Well, actually, this is interesting. We started at the end of December, and we started collecting data. And then we ran into an issue that we're going back and forth with the IRB. And that was on the informed consent form, people started putting in their scene names. Or they would only like put their first name on the signature line. And we've been in discussion, we've had to pause everything. And we're doing this discussion and review with the IRB about whether or not legal names are actually required. And we have a difference of opinion. So hopefully that will resolve, and whatever comes of that, I think we'll share with everyone what the upshot of that is as a kind of best practice. So right now we're paused, but we expect probably to start back up again on March 1st. And once we start, yes, links can be shared. Going to the website is a good way to stay on top and be able to know when the study starts up again. What countries are we interested in? Well, we've had already, even though we've collected for a few weeks, we had interest from people involved, actually from a number of different countries. Australia, Germany, Sweden, the UK, Spain, I think, and a few others. And because this is not really designed to really do some planned comparisons between nations or between countries, this is really much more exploratory. So we're just going to collect from wherever, and then if we do get a certain level of a sample size from a particular country, we may do some ad hoc comparisons later. Okay, thank you.
Thank you so much, Richard. And so this is an amazing start of our conversation. Richard, of course, is very knowledgeable and could speak on this for hours. And I welcome him possibly in the future. We might do an entire event just with Richard talking about this and Richard's team talking about this.
Okay.